Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, symptomatic treatment for multiple sclerosis. In the symptomatic treatment of multiple sclerosis, we have if the patient has symptoms of spasticity, then the drugs like baclofen or tizanidine can be given to the patient. Then, if the patient has symptoms of urine retention, in urine retention, we can give drugs like buthanol can be given to the patient. If the patient has urinary incontinence, then drugs like oxybutyrin is also given to the patient. Now, then if the patient has symptoms of painful neuropathy, okay, if the patient has symptoms of painful neuropathy, then drugs like gabapentin is given to the patient. If the patient has symptoms of increased walking speed, if the patient walks very fast, then we can give drugs like dalfampridine can be given orally. So these are the drugs which are used for symptomatic treatment of multiple sclerosis.
thank you and thank you for watching.